While the 40-year-old drug that's in plentiful supply could help the most severe COVID-19 patients.
Now there's an effort underway to rush trials of the drug, which is usually given to organ transplant patients. CBS 2's Jeff Vaughn has the story.
In the battle for survival against COVID-19, it's a question Dr. Hooman Noorchashm can't stop thinking about.
Why is it that we're not considering cyclosporine?
Dr. Noorchashm is a cell immunologist who trained at Harvard as a thoracic surgeon. He's cared for heart and lung transplant patients.
Most transplant surgeons are quite familiar with what this drug is.
He believes cyclosporine, the same drug that fights rejection in transplant patients, could stop life-threatening lung damage from COVID-19.
The kill mechanism for this virus seems to be actually an out-of-control immune response.
That response is known as a cytokine storm. To attack the virus, the body produces a storm of inflammatory chemicals. Instead of stopping once the immune system kills the virus, the inflammation keeps building. When the lungs are involved, patients can lose the ability to breathe.
By the time patients end on the ventilator, they already have a very high mortality risk. I think the Achilles heel of this problem is going to be turning off the kill mechanism, and that seems to be a cytokine storm syndrome.
Dr. Noorchashm believes cyclosporine may provide the quickest way to do this for the greatest number of COVID-19 patients. For one, there's no shortage. And
it's available vastly internationally. It's quite inexpensive. There's a lot of safety data on it. I think you can envision a scenario where cyclosporine is actually used to block COVID-19's kill mechanism by really dampening the hyperimmune response that leads these patients to get into the ICU and into critical illness.
Jeff Vaughn, KCAL 9 News.
Dr. Noorchashm expects that cyclosporine would be prescribed for 7 to 10 days in patients who have moderate COVID-19 symptoms. He's working to get clinical trials started within the next few weeks.